Welcome once again to the Beauty and the Beast podcast. My name is Dr. Sal Pacella. I'm a board-certified plastic surgeon in San Diego and La Jolla, California, and I'm, of course, joined by my co-host and very good friend, Dr. Sam Jejurikar, who's the president of the Dallas Plastic Surgery Institute in Dallas, Texas. Sam, how are you doing today?
I'm doing so great, Dr. Pacella.
Awesome. So we're going to talk about one of my favorite topics of all time, and that is nose jobs. Fantastic operation. I really find doing this operation very cathartic, very relaxing, and just overall exceptionally satisfying. Many people don't feel that way. Many surgeons. What are your thoughts, Sam?
Yeah, I mean, I think when you talk about rhinoplasty, if you don't do a lot of rhinoplasty, it is a very different skill set than virtually every other operation that we do. As two surgeons that were trained beyond plastic surgery in rhinoplasty, I think we have, an affinity for the operation, and we really enjoy it quite a bit.
The best part about this operation?
Not a lot of people can do it.
There's some people that can do it really well.
Can do it. It's an inside joke. Sorry, but anyways,
best part of this operation, there's one of them, right? There's only one nose.
Yeah, that's
so
true.
we take out the entire concept of doing the same thing on one side versus another. Now, that doesn't necessarily mean we're not paying attention to symmetry, correct? Right?
Yeah, because there's many structures in the nose that are bilateral. And so, yes, that's definitely very true. But, as someone who does a lot of rhinoplasty, do you have patients that come in that say, I want a rhinoplasty, I want a closed rhinoplasty, or I want an open rhinoplasty? Do patients even understand that difference to you?
Well, I think the important thing when we're talking about this is what ability the surgeon has to achieve what they want to achieve based on the technique they do. I wouldn't say a closed rhinoplasty is any better than an open rhinoplasty. I think it's the benefit of the surgeon, right? Mm-hmm. For example, there's a fantastic surgeon in New Hampshire, Mark Costantian. Okay, he's retired, obviously.
Yeah.
Did almost exclusively closed rhinoplasty throughout his career, correct? And, he had incredible results, okay? Another surgeon who you know very well in your practice, Dr. Rourke, does almost exclusively open rhinoplasty, correct?
Yes.
And so I think, to me, I'm more of an open rhinoplasty type of surgeon. To me, creating the structure of the nose, manipulating the cartilage is that much easier. And having a tiny little scar right here at the base of the nose, I think that's something that disappears over time.
I completely agree with that. I think one of the take-home messages that patients that are watching this need to understand is that the scar across the base of the columella is almost inconsequential. One of my mentors used to say, it's a scar that only dogs and lovers can see. And even that, it basically just is not even that visible. The real difference is the length of time that somebody has swelling. And my general approach, because I'll do both open and closed, but I do a lot more open than I do closed, is if someone needs any type of support to their tip, or if they need any type of reshaping of their tip, which is the majority of patients that we see, I can get a better result with it being open.
Now, let me ask you this question. So I think when we look at celebrities and Hollywood, there's probably very few celebrities out there that haven't had some sort of nasal procedure, right? And so I commonly see young women come in to see me for rhinoplasty, and they say, I want my nose to look like this person or that person. Okay, what do you tell them?
That it's a really hard thing to do. There's certain characteristics that we just cannot modify with a rhinoplasty versus the quality of the nasal skin. You mentioned Dr. Costantian, and one of the things that he would always make a big point of was it's not just how you shape the cartilage, but you have to figure out ways to try to bring the skin back down to the cartilage. And the fact of the matter is with this nasal skin quality is different between two people, their noses are never going to look the same. The other thing are functional components of the nose. So we talk about breathing issues, but if you make someone's nose overly small and they have certain anatomic narrowing of certain of the internal nasal valve, or the nasal septum is deviated, you just can't make their nose small and still preserve their ability to breathe.
I agree.
Yeah.
The Victoria's Secret fashion show was on a few weeks ago. And, one of the things that struck me is, I'm watching this and I'm seeing these beautiful women, beautiful hairstyles, beautiful faces and bodies. Not one of them has a perfect nose, right? And, Gisele Bundchen, I don't know if she was in this one, but she's a
No,
supermodel.
I didn't watch it.
Yeah, Emily Ratajkowski. Okay, she's a beautiful social media star
Mhm.
and has a pretty bulbous tip, has a big nose. Okay, and that works for them, right? And so one of the discussions I have with patients are, you don't want to change your look dramatically. You want to maintain your culture. You want to maintain your personality. And I constantly say this phrase: you want your nose to fit your face.
Yeah,
And that it's not a Mr. Potato Head thing, right?
totally agree. I mean, if you think back to Jennifer Grey
Yes. Yeah.
and had a rhinoplasty all those years ago, and it dramatically changed the appearance of her face, that people forgot what movies she had been in, and all they wanted to focus was on her plastic surgery and how much it changed it. What you're referring to is making somebody look better, but still letting them look like themselves, and I think that's really important.
Right.
Um,
Now let's look at a couple of these photos in our group here. So you'll see a couple of these examples of patients that patients may not have perfect symmetry. They may have a little dorsum that's off a bit. And to me, in some of these photos that are in your patients and my patients, is we're really paying attention to the way the light bounces off the nose. Okay,
Mhm.
what we call the dorsal aesthetic lines. And we're always wanting to make these straight. We want to make a little bit of an inverted curve, but it's really dependent on the patient, right?
mhm.
And how does that kind of affect your practice?
So, just to sort of clarify, the asymmetries you're talking about, hopefully, were preoperative asymmetries.
Yeah.
That you're not, but also, yes, what you're talking about is sort of having that gentle ski slope above the tip of the nose, or a supratip break, which is considered the hallmark of a feminine nose. So, in a female patient that's coming in, there are certain things that are universally sort of thought to be feminine characteristics: a rotation of the tip that's slightly up, having a little break in front of the nose. But it's important to have a conversation with a patient where you say, okay, what do you want to look like? I use 3D imaging with my patients because I want to be able to create an appearance on them that I know they're going to like. I believe you use some sort of modeling, or do you do anything with the patients for their noses?
Again, that concept of let's kind of look at what your nose should look like, right?
Mhm.
And so I use a lot of my own pre and post operative photographs to kind of illustrate to patients how that slope should be, how the super tip break should be, how the base of the nose should look.
Okay. Um, I think that's a great time to talk about the differences between male and female rhinoplasty, because one of the things that people don't talk about that much is how commonly men get plastic surgery. And one of the most common operations that men get are rhinoplasty. Why or how does a male rhinoplasty look different to you than a female? What are the characteristics of an ideal male nose?
Right. So in men, I think the key is subtlety, right? And so in women, where we may want to have an inverted type of slope, in men, having a straight slope or a slight bump is a very masculine attribute, okay? We talk about in men the Roman nose or the Apollonian type of nose, and that refers to the radix of the nose, which is right here. That is oftentimes prominent. It's seen as a very masculine attribute, right? I think a danger in male rhinoplasty is over-resection, both of the bone and of the tip, okay? Men routinely have a little bit of bulbousness to their tip, a little bit of a round tip. You don't see men walking around many times with a really defined tip. And to me, that looks very feminizing.
Mhm. I completely agree with that. I think the key to a male nose, even more so than a female nose, is for patients or for the general public not to recognize that the male actually had an operation done. Um, let's talk about the concept of functional versus aesthetic rhinoplasty, or is that even a distinction that we should be thinking about in the current day and age?
I think this is a huge concept, and it's oftentimes ignored in the general aesthetic or cosmetic surgery community. Okay. In our training, we did a tremendous amount of functional rhinoplasty. Dr. Jejurikar and I trained at a huge craniofacial center. We did a lot of pediatric plastic surgery. And so one of the best parts of our training was doing rhinoplasties on patients who have had cleft lips and palates. Those are patients who not only have a tremendous amount of asymmetry in their nose, but oftentimes have some breathing issues. So to me, one of the keys to understanding the function is simply asking the patient, do they have any nasal obstruction? How is their breathing? Have they ever been evaluated for sleep apnea? Do they sleep with a humidifier? Okay. And I would say 9 times out of 10, patients have some underlying breathing problem. One of the workup pieces I do for most patients that come in for functional rhinoplasty is I get a CT of their sinus cavity. Okay, so that tells me whether or not they have any sinus component, but it will also give me a tremendous roadmap when planning a rhinoplasty, because oftentimes these patients have a piece of bone that's obstructing the back of their pharynx or their nasal cavity. And you can do the best rhinoplasty in the world, but if the patient isn't breathing afterwards,
Miserable.
Yeah.
And I think that, even to take that one step further, many of the maneuvers that we can do to create the best looking nose that patients want can have an effect on their airway. So if you think about it, we have to be really careful during the operation not to create a breathing problem that wasn't there ahead of time as well. For instance, when we shave down the dorsum and we break the bones along the side, very precisely. Nonetheless, that can narrow what's called the internal nasal valve, and that can cause breathing issues if we're not aware of that. And so, it's important for patients to recognize that breathing issues are not only important to look for preoperatively, but important to prevent intraoperatively as well. What do you tell the patient? Sorry, you're going to...
Yeah, question for you. So, what is the recovery for rhinoplasty like?
It feels like my social media feed is filled with people who are taking off their splint at their first recovery, and they're like, "Oh my God, I love it." Now I've come to realize that many of those people that are doing that, at least in my own practice, the patients are like 3 weeks out when they're doing that recovery. And I think it's important for people to realize that. Generally, when you take off the splint, you look pretty good. About a week post-operatively, you take out splints from the inside, splints from the outside. You look good. Your nose is big, but you have some bruising underneath your eyes if you're like most patients. Generally, people look pretty socially acceptable with maybe a little bit of camouflage makeup or some bruising underneath the eyelids by about 2 weeks. But it takes a year for the swelling to go away. Doesn't mean you look bad for a year, but swelling gets better in a very gravity-dependent manner on the nose. The upper portion looks better, which is actually sort of a problem when patients are about 6 weeks because they've got a great shape to the upper appearance of the nose. The tip looks kind of fat and round, and they're worried that that's the way their nose is going to look.
So I want to share a little personal story here. So I was a lifelong rugby player and played a bunch of contact sports throughout my life, and certainly broke my nose more than my fair share. And right around late 20s, I was having a lot of breathing problems with my nose. And guess what? My nose is off to the side. So I had a rhinoplasty to straighten my nose. I didn't do anything of the hump or anything to the tip, but for breathing purposes alone. And after that procedure was performed, they did it a very old school way. They would pack your nose with a bunch of gauze.
Mm-hmm.
And one of the most traumatic experiences of my life was when I was sitting in that surgeon's office. It was an otolaryngologist, ENT surgeon, and he's just started pulling that gauze out of my nose, and it felt like my soul was coming out from the inside. And so
explains a lot. All right.
Okay. So I vowed to never have my patients do that. So now I use these sort of silicone splints. They come out pretty easily. And so, you can kind of gain a lot by being a patient yourself, I think.
Yeah.
So.
Well, I think take-home messages for patients: rhinoplasty must be individualized to their personal characteristics, their personal anatomy, their backgrounds. But you can get great results, functional, open rhinoplasty.
Fantastic.
Sure.
Well, we've come to the end of our podcast. Thanks for joining in for Beauty and the Beasts.